Welcome and thank you for joining us today for the meeting of the New York City Health and Hospital Capital Committee. Today's meeting is officially called to order. Please note for the record, Matthew Ziegler is representing Dr. Cass in a voting capacity. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on July 11, 2022. I will poll each member of the committee. Jose Pagan. Matthew Ziegler. Is Frida? No, not yet. Robert Nolan. Okay, and Sally is not. Okay, thank you. The motion is carried. Next, we are going to hear the several resolutions for consideration. I will give the floor to Menji.
Hi, good morning. Thank you, Feni. So the first presentation is seeking approval to enter into contract with two sets of job order vendors. The first is the electrical vendors and the second are HVAC vendors. Next slide, please. So job order contracts are construction contracts that we award based on public bid. They're bid against an item of catalog of services, and they're in compliance with the 100-5. The current contracts we have, both for electrical and mechanical, were awarded back in 2020. They originally were expiring on July 31st, but we came before this body back in July to extend them to 6 months. So they're now going through January of 2023. Next slide. This just shows the utilization for the current HVAC pool. We have two vendors. Hvac is the only active vendor. We utilized a little over $1 million, and we had about 4.9 million remaining. Next slide. This is the electrical pool. We had two vendors, Gemco and Mac & Sons. Gemco, we used a little under 4 million, and Mac & Sons, we used about 2.6. Gemco is primarily used for the point-click care, the long-term care medical record, and Mac & Sons was used for Epic, make-ready work to support the Epic, which is the acute care in Gotham medical record. Next slide. This is the procurement for the HVAC services. We had 3 separate procurements that were opened on June 7th, 8th, and 9th. In the first procurement, WDF was the lowest responsible bidder. Volmar was the lowest responsible bidder in the second procurement, and AWL was the lowest responsible bidder in the third procurement. AWL did receive an unsatisfactory rating in 2019. We did some research into mocks for all of their current ratings. 19 ratings were received after that unsatisfactory, and of the 19, all were either good or above. So good, satisfactory, or excellent. Next slide. This is the procurement for the electrical contracts. We had, similar to the HVAC, 3 procurements on June 7th, June 8th, and June 9th. Gemco was the lowest responsible bidder in the first, Mac & Sons, the lowest responsible bidder in the second, and EIA, the lowest responsible bidder in the third. Next slide. These are the vendor satisfaction surveys. Gemco currently has a good based on the job contracts they currently have with us. Next slide. Mac & Sons has an excellent. Next slide. And Volmar currently has their projects are in progress. They haven't been completed. Evaluations will be provided once that work is complete. Next slide. These are utilization plans for the 3 HVAC vendors. All have presented a 30% utilization plan with the subcontractors you see listed on this slide. Next slide. This is Gemco. Gemco has a 30.25 utilization plan. EIA and Mac & Sons are both New York City certified MWBE, so therefore there will be at 100%. And the last slide is the resolution language seeking approval to enter into contract with these 6 vendors. Thank you.
Thank you, Menji. We appreciate it. First, I would like to call a vote. I think we have to have 2 separate votes. First, we're going to go for the HVAC. Yes, Bob? Oh, you have a question.
I'd like to know if these, if this vote is for the finances for projects that are an existing project, or are they for future projects?
These are on-demand contracts, so we don't know which projects will be utilizing these contracts yet. They're for future work. As they become available, the facilities will utilize these contracts to complete that work.
Okay, so there's nothing in construction now that these funds will be used for, if they're for future projects not yet determined. Is that correct?
That's correct.
Thank you.
Thank you, Bob. Jose, do you have any question, any comments?
Nope, thank you.
Okay, so I would like to take a vote. Jose?
Yes on both.
Okay. Golisa, it's okay that we say that,
Or
or we have to do separately?
No, that's okay. We can say that. Thank you.
Okay, thank you. Matthew Ziegler?
Yes on both.
Thank you. Bob Nolan?
Yes,
On both or only the HVAC?
on both.
Thank you, Bob. Peñasco Peñamora also vote yes on both. Thank you. The resolution is passed and it's going to be forwarded to the full board.
Thank you.
The next resolution.
Good morning. This is a request to enter into contract with Carefree. I think we went right into the resolution. Oh, okay. Authorizing New York City Health and Hospitals Corporation to execute a contract with Carefree Improvements Incorporated, the contractor, to provide construction services in connection with the repurposing of space on the 7th floor of New York City Health and Hospitals Metropolitan Hospital Center, Metropolitan, to create a system-wide contact center for the duration of the proposed construction project for an amount including a 10% contingency of $624,424, not to exceed $6,869,000. So with me is Tamika Campbell and Lisa Hendricks. They're going to be presenting the bulk of the presentation, and they should be online. So Tamika.
Good morning, everyone. Good morning. Okay, project background. So this first slide gives some information. Metropolitan is currently the third phase of the contact center project. First, phase number one, phase number two consisted of Cumberland and Bellevue, which have recently been completed. The renovation of the metropolitan space will incorporate new centralized HVAC systems, which will provide cooling and heat into the space, LED energy efficient light fixtures, new security cameras, and also a new IDF closet, which will support the new space headcount. The space is currently approximately 18,000 square feet. Next slide, please. Okay, the future state, I'm just going to read the first bullet and then Lisa will take over from there. So the space will be built out and will consist of approximately 252 workstations. We will have 12 offices, a staff lounge, 4 huddle rooms, ADA compliant restrooms, and lockers, to provide for the staffing. Lisa?
Yeah, great. Good morning, everyone. To continue where Tamika left off, we expect to use the space not only for an expansion of our e-consult services, which we hope to improve the patient experience, expedite specialty appointments, and continue to grow our specialty services and revenue. We're also expanding the space for revenue cycle. They will be participating in growing an additional 100 financial counselors. Our intent is to, continue to provide and grow our contact center services so that we can be less dependent on outside vendors. And we also want to establish this space as a flexible workspace. So as we did with Bellevue and Cumberland, we established the workstation so that should another department need services, translation, referral, currently we've got some OHS nurses who are also using our space in Bellevue. Anyone can come in and plug in their laptop and work. So it's not just for the contact center, but mainly for the contact center, but we're also expanding and creating that flexibility to allow other departments to use the area, therefore saving some cost in the future for our organization.
Great. Thank you so much, Lisa. Okay, so this slide, which is the main slide for our presentation, which is the ask to enter into contract with Carefree to build out the Metropolitan Contact Center site. Okay, so this slide shows that there is 2 different funding sources for this project, and the Carefree portion of that breakdown consists of the CRFP grant for the 965,917 and the capital NYC capital, which is 5,278,629. So those 2 together will provide you with the 6.244 for the Carefree contract. So we also provided on the bottom just a breakdown that shows a 10% contingency ask on top of the 6.244 for Carefree. Which brings us to a not to exceed of 6,869 million. Next slide, please. Okay, so now this breakdown shows you the full project funding sources. So the breakdown for this shows the grant portion, which we require to have the project completed by March 2023, and that is for a dollar amount of 6,415,932. The other funding source from NYC Capital, which is a 6,843,922. Those 2 together brings us to a grand total for the project budget at 13,259,854. So the bottom we show here the breakdown of categories, which consist of design, construction, outfitting, and that 10% contingency, which is circulated around the Carefree contract. Next slide, please. Now, this slide, we provided some additional detail breakdown of the overall funding source for the project. So we have the 2 categories that are identified and going across. We just gave a little bit more detail. Same, the design, the outfitting, but in this particular slide, we broke out the construction. So the construction, which on the previous slide showed the 10.4 mil, here we show what that entails. So it has the Carefree portion of the construction. Then it has a breakout of make-ready work, which was required to be done in order for us to also meet our guidelines for the grant. So the make-ready work consists of jobs contracts and consultants that were utilized to have the space ready. Then we have our 10% contingency breakdown and our grand total. Next slide, please. So we provided some information on this slide that shows the procurement of the actual contract for Carefree. It was a public bid. We had site tours with approximately 26 vendors. We received 9 proposals. The lowest of those proposals was our Carefree Carefree general contractor. Next slide, please. Okay. So this slide gives some information, additional information on Carefree. So Carefree currently has a jobs contract with us. Their 2018 to 2020 contract had an 84% rating. Currently, their contract, which is a 2020 to 2022, there is no evaluations because they're currently in construction. In addition to that, we had other ratings listed under the mocks, which included 2 satisfactory ratings of 70 to 79%. Oh, also, apologies. Carefree Improvement is an MWBE contractor, so we will have 100% MWBE utilization for this contract. Next slide, please. I'm sorry, next slide, please. Thank you. And this is our resolution language, which we are asking to enter into contract with Carefree for a not to exceed dollar amount of 6.869 mil, which incorporates the 624,424 contingency, 10% contingency. Thank you so much. Is there any questions?
Thank you. Appreciate it. Let me call each member to ask if they have any questions or comments. Jose?
No questions. Thank you.
Matthew Ziegler?
No questions.
Bob Nolan?
No questions.
I have a question. If you go back to slide 5, please. Okay. In here, the budget breakdown only adds to the construction numbers, but where is the contingency coming from? Because when you add the CRFP and the New York City Capital, you only get, as you said, the 6.2.
So the contingency is coming from the total Carefree project, which is the 6.2. So that 10% contingency is only connected to Carefree.
I understand, but the funding sources that you list here only adds up to 6.24. And here, the contingency is 624,000. So where is that 624,000 coming from?
Fanny, I'm sorry, Tamika, if you don't mind. If you go to slide 7, I think we just have to update the numbers and we have to add the 96,000 to the 965 for the CRFP funding and the 527 from City Capital to the City Capital funding source. So those numbers, Fanny, in the contingency column, they were not included in the funding for the slide 5. So we just have to add those numbers there.
To the slide 5, is that correct?
Correct. Yes, correct.
Oh, okay. So it's coming from the two sources
Yes.
divided equally.
Correct.
So you just have to revise that.
Yes, correct.
So in that case, I just want to put it for vote, but I will put a recommendation that be revised before it goes to the full board if this is approved.
Thank you. Thank you, Mandy.
So let me ask for the vote. Jose Pagan?
Yes.
Matthew Ziegler?
Yes.
Bob Nolan?
Yes.
Faniowski, yes. Again, only with that change in slide 5. Thank you. So next, yes?
Thank you.
The next resolution?
Hello. I'm here with Neil Moore from Queens Hospital and Helen Ortega to present to request authorization for the New York City Health and Hospitals to sign an 18-year lease with 90-02 QB Holdings LLC for approximately 40,000 square feet on the ground floor of 90-02 Queens Boulevard, Queens, New York, for the use by New York City Health and Hospitals Elmhurst and New York City Health and Hospitals Queens for administrative office space at an initial rent of $37 per rentable square feet or $1,480,000 per year, which will escalate over the term to reach $45 per rentable square feet over the final 7 years of the term for a total base rent over the term of $28,520,000 after taking into account 1 year of free rent, provided that operating expense escalations payable to the landlord projected to total $1,732,000 over the lease term are not included in the base rent for a total payable rent to the landlord over the term projected to be $30,252,252 and $4. I'm going to turn it over to Helen and Neil.
Thank you, Leora. Good morning, Mr. Chair and members of the Capital Committee and Mr. Ziegler. I am Neil Moore, the CEO of Queens Hospital, and is here in a joint effort with Elmhurst Hospital. Thank you for giving us this opportunity to present to you this morning on space needs of both hospitals. Both hospitals, as you know, are in the borough of Queens and provide a large services to the patient population there. The most obvious and common thing about the two hospitals is that we both have an affiliation contract with Mount Sinai, and we both share staff members across the hospitals. We share other items as well with the hospitals in grant-funded programs and community-based programs as well. Helen and I meet on a regular basis to talk about how we align in providing services in the community. So we thought it was fitting, since both hospitals have needs for space, that we both come before you and to make a request for our space offsite. I will now turn it over to Helen.
Good morning, everyone. Good morning, Chair. Good morning. I'm very excited to be here with my brother Neil on this project. But the main goal of this project is two things. One, to maximize our current capital fundings that we have, which equals about 200 mil between both hospitals. But more importantly, this really sets us up to really maximize the full potential of capitals that we can take advantage for both hospitals. So in this slide, if you can go back one slide. So for Elmhurst Hospital, as you know, we're a 545 bed unit. Elmhurst Hospital will benefit about $160 million capital project over the next 5 years. This additional support of moving back end support to the offsite will really help these following key projects, which all have been funded. And next slide. For Queens, Neil will speak.
Yes, so the movement of staff offsite will help us to create clinical space as well as other staff member space. Queens Hospital is a 269-bed hospital, and the benefit of this will be about $44 million over the next 5 years. Our project includes renovation of N4, the P4 outpatient behavioral health and primary care clinic, and our outpatient retail pharmacy.
As you can see here, we kind of mentioned the high level what the new office spaces will give us. It gives us opportunity to share offices for some back end function. The project will allow both Queens and Elmhurst to open up space for critical capital projects and new clinical programs in Queens. But more importantly, it gives us a convenient and attractive location near both of our hospitals and gives us a presence on Queens Boulevard. And Laura, you'll speak to.
Sure.
Or do you want us to?
You can speak to the location and
Okay,
when you
so go,
bring
Neil.
that.
So Neil will speak about Queens Boulevard.
So the office space at Queens Boulevard, the new office space on Queens Boulevard is to accommodate 91 employees from Elmhurst Hospital and 50 employees from Queens who perform back office functions. Again, the back office clearing out these employees will give us the ability to expand more clinical services within the hospital. The travel distance between is 15 to 20 minutes from Elmhurst and Queens Hospital. Location is accessible to various modes of transportation and includes parking. And we have already established a shuttle service that will be able to have staff commute amongst the or between the hospitals.
I'm back again to talk about the lease terms, and I'm also here with Jeremy Berman, our Deputy General Counsel. The resolution requests a new lease for 40,000 square feet, as we mentioned earlier in the authorization language. This is ground floor office space. It would be an 18-year term that commences after the landlord completes work towards the space. The landlord is planning to contribute approximately $50 a square foot towards that work, and the 12 months of free rent will commence when that work is complete. The base rent is $37 per square foot, and our comps support that, or $1,480,000 annually. This will escalate by 10% every 5 years. In terms of annual expenses, H&H will not have to pay real estate taxes. H&H will be the sole occupant of a condominium unit. We, as we always do, pay our own electricity. And in terms of operating expense escalation, we will pay our proportionate share of increases in operating costs over the first year's actual expenses. And those typical costs are insurance and labor to staff the building, repairs, and we expect the annual increase to be about 25 cents per square foot per year. The next slide is just illustrative of a truncated cash flow in two 5-year increments and one 7-year increment. And that's it.
Thank you. Again, thank you everyone for the presentation. I would like to ask the members of the committee if they have any question. Jose?
No questions, just want to commend you for planning for the future and for current needs, and looks good to me. Thanks.
Thank you, Jose. Matt Ziegler?
No questions, thank you.
Thank you. Bob Nolan?
No questions.
Thank you. Again, I just want to kind of echo Jose's comment about your planning ahead and understanding the capital needs that you have and ensuring that you have a space available to reallocate functions as you upgrade your facilities. And I also like to commend you for looking at a location that is accessible for by public transportation, as well as putting the shuttle to connect to the two hospitals. And this shows, again, another way of integrating services between the hospital to ensure the best services to our patients. So again, I just want to commend you for that and echoes Jose's comments. I would like now to ask for a vote. Jose?
Yes.
Matt?
Yes.
Bob?
Yes.
Peniowski also yes. Thank you. Thank you so much. I believe that those are all the resolutions today. Is that correct?
Yes, that's correct.
Okay, so now do we want to do the presentation by?
No, I think we're finished with all the with resolutions and presentations, Penny.
Oh, the presentation.
Yep.
So very
Okay.
efficient.
Okay, very good. It gave us 29 minutes back to our lives. We really appreciate your efficiency. So I just want to ask if there is any new business or old business.
You say.
If there is no any further discussion, I would like to adjourn the meeting. Thank you, everyone. Bye-bye.
Thank you.
Thank you, Penny.
Thank you.
Yeah.